All right, we're being recorded.
Thank you. Good morning. My name is Pebbles Brown, and I want to welcome you to the webinar Fall Prevention Resources for Health and Fitness. The main reason we're having this webinar is because the Quality Council for DBHDS Region 4 is working on a project to reduce the rate of falls for people who are on the Developmental Disability Waiver. As you heard, a bit of housekeeping, we are recording this webinar and we plan to post it on the DBHDS YouTube channel. If you have any questions during the presentations, please ask them and put them in the chat, and our presenters will choose a few to respond to at the end of the webinar. Please note that all questions will be addressed in a Q&A document that we will make available on the website later. So in this webinar, we will be reviewing some information about why it's important to focus on falls and considerations when it comes to people with developmental disabilities. Then we will focus on the role of physical fitness and strength. Afterwards, we will hear from some experts on local evidence-based programs and resources to help prevent falls. We will move on and look at some new resource materials on fall prevention that you will be able to access and use today. Finally, we will wrap up with a Q&A. At the very end, we have reserved time for you to complete a brief evaluation of today's webinar. We ask that you please take time to do that. It will be greatly appreciated. So before we get started into the material, we wanted to share a definition of a fall that is used by DBHDS. The Virginia Department of Behavioral Health and Developmental Disabilities defines a fall as any situation in which someone descends or falls suddenly or involuntarily toward a floor, a lower surface, or the ground. So why focus on falls? Well, let's begin, but before we do, we're going to start with a poll question. Let's get your poll question. And the poll question is, it should be in the chat.
Not yet.
It's coming.
It's coming. It's coming. There it is.
Okay. So if you wouldn't mind answering this, in the past year, have you, if you are an individual or you have supported an individual or someone who had a fall which required medical intervention? We'll give you a few seconds to respond.
The results are coming in. It's so fun to see them like in real time, like how many people are responding.
Great.
Good job, guys. We have 97 people on the line. We have 31 responses so far.
Okay, just a few more seconds. When we get to about half, Mary Beth, would you mind to tell us the results?
Sure. It looks like it's really slowed down. So we have 34 people and 44% said yes, 38% said no-ish, and 20%, including myself, said not applicable.
Okay.
So about split, but more yeses than nos.
Well, that is what we kind of figured. So let's talk about this. Of the causes, and thank you guys, first of all, for taking time to do that poll. So thank you. Of the causes of serious incidents that are tracked by DBHDS, falls is the highest. DBHDS collects data on level 2 serious incidents related to falls that are associated with an emergency department visit, an unplanned hospitalization, and/or a serious injury that required medical attention. In this statewide graph, the arrow is pointing to a line depicting the rate of falls per 1,000 individuals on the developmental disability waiver. This is since 2021. What you see here at that time, it was around 48 per 1,000, and during the most recent quarter, it was 64 per 1,000. Along the way, the rate has fluctuated, moving up and down, yet the trend demonstrates it continues to increase over time and remain higher than other reported serious incidents across the state. This is why it is a very important issue to try to understand and work to address. Now, let's take a look at this for Region 4. This Region 4 covers the Richmond metro and surrounding areas in central Virginia. So as you see here, there is a noticeable peak of 97 for falls at the beginning of 2024, but has since decreased to 72 per 1,000 in the most recent quarter. Recognize that this graph follows a similar pattern as the statewide one on the previous slide, in which the rate of falls is higher than other reported serious incidents. Now, in this graph, we compare the rate of falls for Region 4 to the other 4 regions in Virginia for DBHDS. Again, the pattern is similar to the other 2 graphs. Again, what we see is there are more stretches of time when Region 4 was higher in falls than the other regions, thus solidifying why Region 4 Quality Council decided to choose falls and trips as our quality improvement initiative. So these next couple of slides contain information from the DBHDS Office of Integrated Health. The links to the information are on the bottom of the slides. So we're talking now about risk among individuals with DD, developmental disabilities. Individuals with DD experience fall injuries at a much younger age and at a double the rate of their peers without DD. Also, half of all falls experienced by an individual with DD result in a serious injury and/or hospitalization. Likewise, most falls experienced by individuals with DD happen during activities such as daily living, personal hygiene, dressing, and mealtime. There are 3 main areas that put individuals with DD at high risk for falls. First, let's look at the physical, which includes cognitive delay, impaired mobility and gait, urinary incontinence, and poor balance. Under behavioral, we have shortened attention span, hurrying, rushing, running, and being easily distracted. And then environmental, including such elements as slippery floors, cluttered pathways, and uneven terrain. Now, the first 3 factors on this slide were also indicated in the previous slide. So along with cognitive delays, seizure disorder, diagnosis, and polypharmacy, which is taking more than 4 medications, additional factors that can increase fall risk include using walking aids, diagnosis of arthritis, and difficulty lifting and carrying greater than 10 pounds. This is indicating low upper extremity muscle strength. So now when discussing falls and aging for ages 65 and older, it is important to note 4 things. Firstly, falls are the #1 cause of injuries and death from injury. Secondly, 1 out of 4 persons will fall this year. Thirdly, 1 out of 5 falls result in serious injury. And fourthly, 95% of all hip fractures are due to falls. So while falls can happen at any age and may affect those with factors mentioned in these previous slides, we must remember that the population in general is aging, and this includes people with developmental disabilities. So how do we reduce the risk of falls? Some of the preventative strategies include assessing and addressing individual fall risk, use of durable medical equipment such as shower chair, toileting chair, and grab bars, environmental modifications, including non-slip mats, textured flooring, and better lighting. And lastly, for this webinar, we want to focus on this last bullet. We're going to examine fitness and strength, modalities and resources to support improving balance towards reducing falls and the risk of injury. So let's look at some data about fitness when it comes to people with developmental disabilities. And to present that, we have Mary Beth Cox. She's our Quality Improvement Implementation Manager for DBHDS. It's yours now, Mary Beth.
All right, great. Good morning, everybody. Thank you again for being at today's webinar. I'm going to ask my fellow presenters to man the waiting room while I'm talking so I don't miss it. We're having to admit people one by one. So, thanks for everybody's patience with our technical issues today. They're bound to happen. It's a fact of life these days. All right, so before I get into some data, I think we have another poll question to help you think about this issue. So the poll question is, on average, how often do you, if you are an individual with a developmental disability, or how often do individuals in your care do physical exercise for at least 10 minutes? And that's per week. So your options are never, 1 to 2 times a week, 3 or 4 times a week, or 5 or more times per week. I'm just going to answer for myself. All of this makes me think about my own life and my fitness and my fall risk. Let's see what's in the chat here. So everybody should be able to see the question and the responses in the chat as they're coming in. So we had about a third of people participate before. Let's see if we can get there again. Yeah, and if the poll isn't working for you, yeah, go ahead and type your response into the chat. So thank you, Karen, for doing that. We have 30, 1 to 2 times a week. Great. 3 or 4 times a week. All right, so we have 32 responses, and it's about a third.
Yeah,
And let's see, very few people said never. Okay. And a third, picked one of the other categories, which is interesting. All right. So I think that kind of helps you get into the mind frame of thinking about fitness, right? Just like the other one helped you think about falls. All right, so let's go to the next slide, please. All right, so this slide has a lot of data on it, and I'm going to walk you through it. So we're going to first look at the graph that's on the left-hand side. This data comes from the 2022-2023 National Core Indicator In-Person Survey. This is an interview-based survey of individuals with developmental disabilities who are 18 years or older and receive at least one paid service from the state in addition to case management. Okay, just think about that's who we interviewed here, who were interviewed. The question asks, how many times do you do any physical activity for at least 10 minutes at a time each week? So that's a question you guys just answered, right? This graph depicts national data from across the country. So as you can see, 18% of the responding people said none. That's about 1 in 5 people. A similar percentage said 1 to 2 times a week and 3 to 4 times a week. Nearly 40% of people said 5 or more times per week, which is 2 out of 5 people. So overall, you can see that in this blue bubble here, 82% said they do this at least once per week. If you look on the right, you can see the results for Virginia. Virginia was slightly lower than the national average at 81% of people saying they exercise once or more per week for 10 minutes. The lowest was among people who live in a group home at 79%, and the highest was among people who live in either sponsored residential setting or their own home or apartment, about 86%. So interestingly, at the bottom of the slide here, other states participated in this, and the range for other states was between a low of 72% and a high of 94% doing some exercise. All right, so let's look at the next slide. There we go. This is also NCI data from that same survey, but this question asked, how many times do you do exercise that makes your muscles in your arms, legs, back, or chest work hard each week? So this is more rigorous type of fitness that is more likely to build muscle and strength. You can see the results are quite different. It's like flip-flopped, right? 67% of people said none. No, they didn't do any of this. That's about 2 out of 3 people. 16% said once or twice, 8% said 3 to 4 times, and 9% said 5 or more times. So again, and in total, that's 33% of people doing some type of this activity every week. So Virginia's results are on the right again. Virginia was slightly higher with 35% of people saying they do some type of exercise that makes their muscles work hard, and 65% saying none. And again, the lowest was among people who live in a group home at 32%, and the highest among people who live in their own home or apartment. So let's look at the range in other states. The low was 18%. And the high was 51% of people doing this type of exercise. So hopefully that just, excuse me, helps you think about the level of activity that's currently happening among people with developmental disabilities. All right, so let's talk about the benefits of physical fitness. A lot of this you may know, and that's okay. It's sometimes good to review. There are numerous benefits of physical fitness. First, let's talk about benefits for a body, starting with heart health. Fitness helps build your cardiovascular health, which can reduce the chance of heart disease and stroke. Heart disease and stroke are among the leading causes of death, including among people with developmental disabilities. Physical fitness helps build your strength and muscles, which can help with a person's mobility and ease of using their body the way they want to use their body. It is certainly related to the next bullet, which is improving balance, right? This is very important when it comes to fall risk. This means a person is better able to remain upright or in a stable position when something threatens to upset their physical. All of these can result in reducing the risk of falling or having a serious injury if you do fall. Beyond the physical benefits, it can improve a person's overall confidence and sense of well-being. They can feel better due to chemical and biological effects of exercising and have a sense of accomplishment. It can also get somebody out into the community more than they were before, either by using outdoor spaces like parks and trails or using a community resource like a gym. It's possible you could also meet new people by doing physical fitness in community spaces, like by joining a team or a club, or doing a group exercise class, which is how I've recently met some new friends. So I'm sure you can also think about some other benefits. So I'm going to pass it back to Pebbles to introduce our next speakers.
Thank you, Mary Beth, and thank you for that information. So now, did you know that there are a number of programs that have been researched and shown to have scientific evidence that they reduce the risk of falling? Well, today we are pleased to bring to you presentations on 4 evidence-based fall prevention programs from some of our community partners. First up will be Jody Winship from Richmond Aging and Engaging presenting Bingo Size. Next, we will have Mona Burrell and Karen Day from the Virginia Department of Health. Mona will be presenting on Walk with Ease and Tai Chi. Then I will follow their presentation with a brief overview of information on a matter of balance, which was presented to me on behalf to present on behalf of Andy Platia from the Department of Aging and Rehabilitative Services. So now, beginning our presentation, we have Jody Winship.
Good morning, everybody. I'm so happy to be here today. Let me get my slides shared with you. So bear with me for 1 second as I get this going. Okay. So now let me present. Okay. So everybody good? Are my slides showing?
Yes.
They look great.
Perfect. All right, everybody. Again, thank you so much for being here. I'm really excited to share with you our experience with Bingo Size. My name is Jody Winship, and I am the Executive Director of Richmond Aging and Engaging, which is a nonprofit organization in Richmond. Today, I'm going to describe the Bingo Size program and our experience with the program, give you some tips and tricks that we've learned along the way. But I want to start by telling you a little bit about Richmond Aging and Engaging, just to give you some context of who we are and why we started implementing Bingo Size and the participants that we use it with. So we are an organization, and our mission is to support the health, wellness, and quality of life of older adults aging in place in low-income housing. And so we provide activity programming within the buildings where these folks live. And we have 2 basic programs. We have our Art, Leisure, and Recreation program, which is where Bingo Size is implemented. And this is a program where it's sort of like a senior center on wheels, we like to call it. We provide activities there. We do arts and crafts, we do Bingo Size. We do lots of different activities to support the physical, cognitive, and social health of our older adult participants. We also run a rollator repair program. And rollators are 4-wheeled walkers that a lot of people use, and you may even have people in your communities that are using rollators. And they're really important for community mobility in particular, for keeping people's balance as they're moving around. But these things break down just like any equipment. So we train students to fix rollators and maintain them, and we hold pop-up clinics throughout the community. So as I said, we provide our programming in low-income housing. Right now, we are operating in 3 buildings, 2 in north side of Richmond and 1 in the East End. And our participants, as I mentioned previously, are independent living older adults. So we're not working in nursing homes or assisted living. These are apartment buildings. But they're designated by HUD as being senior apartment buildings. So that means that folks have to be 62 or over or have a disability. And we actually do have a number of folks that are living in our buildings that are younger. Most of the disability is around mental illness, some brain injury, things like that. These folks, in order to live in these buildings, have to have less than 50% of the median income, which in Richmond is below $38,000. But I can tell you that most of our folks are making substantially less than that. Our mean age of participants is just under 66. Our oldest participant is 89, and our youngest participant, I don't have it on the slide, but I think she's turning 31 this week, actually. Things to note. So with our participants, especially at our building where we implemented Bingo Size, have very low levels of education. So very low reading literacy, which is going to play into a little bit what I share about bingo size, but also very low health literacy. And a lot of our folks have mobility challenges. So why did we start implementing bingo size? So our folks were not very active, and they talked about wanting to be more active and wanting to be more physically fit. So we started by doing more traditional programs. We tried to start a walking group where we would take folks out for a walk, but our folks were so deconditioned that they would make it half a block and be too exhausted to go on. We tried to implement sort of traditional fun, like Zumba type dance classes in the buildings again. But because they were so deconditioned, they would last a couple of minutes and sit down and not be able to continue. So they wanted to be more physically fit, but the traditional methods weren't meeting their needs. So we stumbled across Bingo Size a little over a year ago. Bingo Size is an evidence-based falls and exercise and health education program. It was developed at Western Kentucky University by Dr. Jason Crandall, who is a professor in exercise science and kinesiology. And it's a program that combines exercise with health education and bingo. When he originally designed it, it was specifically for sedentary older adults. But as you'll see, the program has been expanded and is being implemented in a lot of different populations. But as I was researching what can I do with my older adults that I work with, this idea or this targeting of these sedentary older adults is what really piqued my interest, because that was exactly the population that I was working with. So Richmond Aging and Engaging got a small grant to cover some of the startup costs, which I'll talk about in a minute, to implement Bingo Size at our East End location. So quick disclaimer, Richmond Aging and Engaging is licensed to implement Bingo Size, but we are not Bingo Size, and I'm not speaking on behalf of Bingo Size or Western Kentucky University. At the end, I'll provide you the website for Bingo Size, because all this information and research and things are available there. So, Bingo Size, what is it? What does it look like? What's the purpose? The goals of Bingo Size, and this is from the Bingo Size website, are to improve or maintain mobility and independence, to learn and use health information focused on falls reduction, nutrition, and other health-related behaviors, and also, really importantly, to engage in social settings. The original curriculum that they developed was the falls prevention curriculum, and that is approved by the National Council on Aging as an evidence-based falls prevention program. They've since created a nutrition workshop, which is approved through SNAP. They have an exercise-only workshop where you're just doing the exercises in the bingo, but not the education piece. And they have a range of motion workshop. This one was specifically designed for older adults in long-term care, folks with dementia or severe cognitive impairment, where some of the other activities and learning modules weren't relevant or appropriate. So there are three components of Bingo Size. There is the exercise, there is the health education, and then of course there is the game of bingo. And so the program was developed so that Bingo Sizers complete these strategically inserted exercises and health education question between the numbers. So it gives them a rest from the exercise while they're doing the bingo. The exercises that they use in Bingo Size are time-based, and they're not repetition-based. So what that means is that for each exercise, there will be a designated time frame to do it. So for example, for 30 seconds, you're going to do chair stands. Why I really like this approach rather than repetition-based is that it allows for a lot of different fitness levels to participate together. So somebody who maybe is a little bit more physically fit in 30 seconds are going to do more repetitions naturally, versus somebody who is a little bit more deconditioned that maybe can only do a few repetitions. But everybody is able to participate together, rather than saying, all right, everybody, we're going to do 10 reps. And those folks that aren't able to do that feel left out. So the exercises with Bingo Size, they're time-based. They are adaptable for seated, for folks that are in wheelchairs, but also for standing. So in the programming, they give different adaptations and modifications for each exercise. And as you'll see in the videos that they provide demonstrating it, they also have visually people with different abilities doing the exercises together, which I really think is great. The entire program is sequenced so that the intensity of exercises sort of increase and give people rests in order to give them the best workout. And it really touches on all the things that you want in a workout. It touches on range of motion, focuses on balance, muscle strength, and some cardio too. The second component, the education piece, the program provides scripts to introduce topics. So each session, there is a specific, for example, in the falls prevention curriculum, each session is focusing on a different component of falls prevention. And the way that it's introduced is not through me standing there lecturing at folks, but it's inserted through questions, through multiple choice questions or true false questions. And that's the entryway to discussion. They also provide take-home materials to reinforce learning in between sessions. And then, of course, bingo, which is the biggest buy-in for participants, is come out and play bingo. And it's just traditional bingo. So in between questions and exercises, you usually do 3 to 5 bingo rolls. I find this really beneficial, one, just for motivating folks to come out because our folks love to play bingo, but also it gives them a break in between exercises. It gives them time to rest. So they're more willing to push themselves a little bit on the harder exercises, knowing that they'll get to take a break for a few minutes. Some of the logistics of this program. So the evidence-based program, if you're implementing it as specified, it is a 10-week program, and you implement bingo size twice a week for 10 weeks, and they're non-consecutive days. So you do it on like Tuesday and Thursday or Monday and Wednesday. Any deviation from their set standard of implementation requires permission. So at Richmond Aging and Engaging, we actually got permission to run it once a week for 20 weeks. The reason is based on our access to the buildings that we serve, and also our participants didn't think that they would be able to attend twice a week. We did it once a week for 20 weeks. Each session lasts between 45 to 60 minutes. And there are options for doing it in person or remote. So if you have participants who have access to computers or iPads, they can do it at home using that. I will say we've only done it in person. So what I'm going to talk about today is the in-person version. So I want to take a minute. Let's see what this program looks like. So Bingo Size has all the modules are online, and the system allows you to go online and go through each sequence without even having to do a lot of thought. It's all laid out for you. So I'm going to show this video, which is just a couple minutes of what it looks like to implement Bingo Size using this module. So this, you can see they even have the bingo rules online. And you can do usually 3 to 5 rolls in between exercises. And if somebody wins, they have a little bingo celebration. Size. At my site, we even have a special dance that we do when that comes on. Here's an example of the multiple choice questions that come up. There's a script that you can read after people have made their choice to kind of provide more information. And then the exercises. So this is one of the common exercises called morning walk.
Begin walking in place. The pace or speed will be a little quicker than walking. If you can, on every step.
So you show the video to kind of demonstrate what the exercise is going to be.
To increase difficulty, pump arms back and forth. The faster you go and the bigger the motions, the more difficult the exercise.
And then you set the timer for however long you're going to do it for, and then you do the exercise together. And then the next exercise comes up. So that's the general flow of how it works. There's usually 3 to 4 exercises, a question, and then you do some bingo rolls. And it keeps the flow going because you're always kind of doing something different. It keeps the momentum going. It keeps the excitement up. And I'll give you some other tips in a second of what we did to make it even more fun for our folks. So things to consider if you do want to run Bingo Size at your site. It does require a license to do. So a 2-year license to run Bingo Size is $420. And the license allows you to run Bingo Size in one county. So for example, Richmond Aging and Engaging can run Bingo Size in the city of Richmond. If we did it anywhere outside of the city of Richmond, we'd have to buy another license. It does require the facilitators to be trained. So I have myself and another one of our volunteers are trained to run Bingo Size. There's a cost attached to that. And then there's the equipment. So when you start up, they offer what's called Bingo Size in a Box, which provides the standard equipment that you need, like the resistance bands for strength training, stress balls, and some of the starter prizes. So things that we found as we were piloting the program and sort of a little bit of tweaks that we had to make. So one thing that we needed to do was get different bingo cards. They provide paper bingo cards that you can use. You can laminate them and use a marker. Well, our folks needed bigger font. So we had to purchase these sort of large font bingo cards, but they're reusable, which is really great. But again, it was sort of one of those added costs that we weren't thinking about. Our participants definitely prefer manual bingo. So you saw in the video how they've got, the electronic version of the bingo ball dropping. Our folks do not like that. They need to actually spin the little cage and see the ball drop. And so Bingo Size doesn't come with that. If you need to have one of those manual games, that's another thing that needs to be purchased. Another thing that we learned is the use of prizes or the need of prizes. So Bingo Size provides sort of little trinkets. You can see in the image some examples of the prizes that they send in their Bingo Size in a Box. It's things like little grippy socks or pens or Kleenex packs. For a lot of reasons that I won't get into, we can talk about it later if necessary, that wasn't enough for our participants. So we ended up having to purchase prizes every week. So we were doing, for what they wanted and what their needs were, we were doing a lot of household goods like toilet paper, laundry detergent, things like that. And we go through like 3 to 5 prizes per session. But thinking about that, we're running this program for 20 weeks, those costs add up. So just something to consider. T-shirts, they provide one Bingo Size T-shirt for the facilitator, but if you want them for your participants, they do have them available at a cost. They're $22 each. We hadn't anticipated that our participants would want shirts so badly, so we didn't budget for this cost. But it ended up that they wanted the shirts, and we ended up, spending a little bit more money to get them. But the benefit is that it provides sort of this group cohesion, this sense of pride. They put on their bingo shirts before they come to Bingo Size on Tuesdays, and it's been really great. It really provided some excitement for them. Another thing just to be aware of, if you're thinking about running the falls prevention Bingo Size in particular, the content of this is really focused on older adults. So when they're doing the education and the questions, it's really specifically geared towards older adults, and they talk about older adults and statistics around older adults. So considering that, if you're using this with a younger population, will that be appropriate? Will they be okay with that? Will they be able to generalize how it relates to them? A lot of the content when they were doing environmental modifications was geared towards people living in houses. My participants live in apartments, so there were a few sessions where they didn't find it relevant because they're talking about things that they had no control over. So just things to think about or be aware of. The exercises that they do, they are very simple exercises, and like I said, it's time-based, which I love, but there was still some challenge with people being able to maintain correct form. The bingo size requires one facilitator for up to 20 participants, but we found that we really needed extra hands for hands-on assistance, making sure that people are using the correct form. And then finally, a few more tips and tricks. Music really matters. Music is what gets people excited and motivated. Bingo Size provides a Spotify playlist. We've created our own list based on songs that they like. There have been times when a good song comes on, and even if the timer is set to 20 seconds, if a good song comes on, we may be exercising for a minute. So we've really liked that. Other things that we've done to make the activity more interactive, when we are doing the questions, we have created little, they're multiple choice or true false questions. So we have little cards, A, B, C, D. So when we ask a question, everybody holds up, their response, what they think it is. And that's been a really nice way to get people involved and help to facilitate discussion too. And then finally, for the questions that are included as the education component, we compiled them all into one workbook. So rather than giving them one sheet of paper each week, we put it all in one book, and it kind of provides this sense of sort of pride. It makes them feel like, hey, we're taking a class. So they come down, and the first thing they do is they go find their book and they find their page. So I thought that was a really useful sort of adaptation that we made. So the verdict, as I said, we piloted this. We didn't know how it was going to go, especially with the adaptations that we made doing this for 20 full weeks. We had 8 participants that attended at least 70% of the sessions, and this may not sound great, but for this building in particular, that's a really great attendance rate to get that many people to continue regularly for so long. We had 3 participants who were regular participants, but because of hospitalizations and one death, unfortunately, they weren't able to continue. And then we had another 5 individuals who would kind of sporadically attend. We are in the process of looking at the data that we collected during the program, so I don't have any of that to share with you right now. However, I can say that the participants have requested to continue with the nutrition curriculum. So a couple of weeks ago, we started bingo size nutrition. So to me, that's evidence that at least there was satisfaction with the program and buy-in from the participants that they want to do it and they're getting something out of it. So to sum it all up, I think that Bingo Size is a really easy to implement program because they provide everything that you need to do it. It's also great because it's adaptable to various populations and various settings. The one drawback is that it's not cheap, and to continue to do it ongoing with those bingo prizes, it can add up over time.
Great.
We
Great
found
information, Jody.
Yeah.
Yeah.
And
Thank you.
yeah, and so feel free to contact me if you need anything else.
Absolutely. Like Mary Beth said, everyone loves bingo. So thank you so much for your presentation. So the next presentation that we have is Mona Burrell. She's with the Virginia Department of Health, and she's going to talk to us about Walk with Ease and Tai Chi. Welcome, Mona.
Thank
You wanna-
you. Yes, good morning, everyone. All right, I am now going to share my slides. All right. Good morning. My name is Mona Burwell. I'm the Arthritis Program Coordinator. Along, we have Karen Day, who is the Arthritis Coalition Coordinator, and wear many hats under the Virginia Arthritis Program. So today we're going to talk about the arthritis appropriate evidence-based interventions. And so just to sum it up, they are evidence-based programs to help to decrease falls, also to help those who have arthritis and other chronic conditions as well. So just to give a little data behind arthritis, so multiple chronic conditions have higher comorbidities prevalence, and this is including heart disease and diabetes and obesity. So as you can see that amongst those chronic conditions, majority do have also underlying of arthritis. And we know that for us with arthritis, it is association with falls. Arthritis has increased joint stiffness and swelling, but also one thing I want to point out is depression. For those who have arthritis, because of the pain and the mobility has decreased over time, they do lose independency and also lose mobility. The impact of arthritis related to complications to mental health. For most, it is women and younger adults. They also suffer with chronic pain and other chronic conditions. So, therefore, the anxiety increase may due to worrying about overall health, fear of falling with walking, and many other reasons. And then depression due to losing independency, ongoing anxiety, and other reasons. I'm just speaking personal from a personal story. My mother have also suffered from those mental health conditions, anxiety and depression due to arthritis and as well increased falls over time. On a wonderful note, we do offer 3 programs: Walk with Ease, Tai Chi for Arthritis, Chronic Disease Self-Management Program. And so we are going to go a little deeper into the programs. Walk with These have been founded through the Arthritis Foundation. So it is a program proven to reduce falls of arthritis and improve overall health. And as we know that if we are increasing our physical activity, we are also reducing falls. Walking is great. It helps reduce stress, improve mood, boost energy, and also you build your bone strength, nourish joints, and strengthen the hearts and lungs over time. And as well, it's inexpensive. So going for a walk is inexpensive, convenient, fun as well. So for participants, adults with arthritis, but you don't have to have arthritis. So walking is a program or exercise that is good for everyone. If you are a beginner or a seasoned walker, it's good for both. The main thing is just as long as you're able to stand on your feet for 10 minutes or more without increased pain, this program is for you. And how can you find our program? If you visit vdh.virginia.gov/arthritis, you'll be able to find Walk with These program where it can be a self-directed program. So you can log into our portal and be able to start the Walk with These program immediately right now on your own. And then also if you want to just find a group or you want to find a walk with these walking group, we do partner with area agency on Asian Virginia Corporate Extensions, and many other organizations. So you can go to our webpage and you can search for Walk with These in your community through findhelp.org. We do have resources. So you think about having this program right at your in your office, in your organization. You can actually go to our website, get pamphlets, rack cards to help promote the program. Or if you want to just share that within your organization, and so the participant would know where to go and find these programs, the rack cards is readily available for you as well. And along with the Walk with Ease program, you can also become a leader. So if you are interested in becoming a leader in the Walk with Ease program, you can contact us as well. It's on our website under Contact Us, and you can share, hey, we would like to become a Walk with Ease leader. And to become a leader, you have to be CPR certified. And once you complete this certification, we will also send you an access code where you can take the Walk with Ease training online. And normally you can complete the training within 2 hours. Or sometimes, depending on your schedule, you may need a little longer. But the great thing is you can take as long as you like, but not too long. Great to mention chronic disease self-management program because the program itself, it does talk about physical activity, but sometimes if you're anyone like me, I need to take action steps. So I actually need to sit down and think about a goal that I can meet within a week. And so with the chronic disease self-management program, it does talk about physical activity and also help you with goal setting. It is a 6-week program where you meet virtually or in person in your community, or if your organization is interested in hosting a chronic disease self-management program on site for your community, then that is something that we can also assist you with. And once again, you just go to our website under Contact Us, and we'll be able to guide you through that process. The CDS&P program, which is a chronic disease self-management program, it was established through the Self-Management Resource Center, which was originally at Stanford University. So this program have years of study. I, as a leader and as well as a master trainer, have facilitated many of this program in the community and great success. And so the most important thing about this particular program is that the goal setting of what goals they want to reach each week. And I think that's a great start when it comes to just getting into any physical activity program. So it is for those who have arthritis, but other chronic conditions as well. So even though we do speak on arthritis, we speak on a bigger picture. You will learn techniques to deal with problems. And it can be problems when it comes to starting a physical activity program, frustration as well. And then some pain associated can come from depending on the physical activity program you start with. And it also is addressed as like isolation. So learning how to communicate with your physicians, with family members can be very challenging for those who are dealing with a chronic condition or for those who want to increase physical activity but have a chronic condition. What are some communication skills that can help that person? So this is a program to definitely get started with. Also, it provides appropriate exercises for maintaining and improving strength and flexibility and endurance for the program. And also, nutrition is part of this program too, because nutrition plays a big part when it comes to also incorporating physical activity. Then there is Tai Chi for arthritis. So Tai Chi for arthritis was developed by Dr. Paul Lim using the Tai Chi Sun style special modification for arthritis. This program can also be done seated and not only standing. So if you are looking for a Tai Chi for arthritis program, you can also go on our BDH website to find a program near you. We have a couple of platforms you can find it, but I'm going to take a deeper dive in that right after this. The program include warm up, 1 or 2 new movements, nice and slow movements that a person can incorporate. It actually increase your muscle strength, improve balance and flexibility as well. And so the program, it is a 16 session. So either 1 hour per week for 16 weeks or 1 hour twice a week for 8 weeks. The program include cool down and as well learning 1 or 2 new movements per lesson, per session, and breathing techniques, which is very important when it comes to exercising overall. This is a wonderful beginner program that can lead into other physical activity programs as well. So now you say, okay, I have shared about the programs, how can I actually refer these programs to my clients? How can I refer the programs to the clients? And how can I find them? As I mentioned, you can go on our website and you can definitely find a program near you. But also, we work with Unite Us. So Unite Us is a platform that's normally for providers, so it's a closed loop program. But I want to highlight this because in case that you are a nonprofit organization and you are interested on how to refer your clients to the programs available, or maybe even social determinants of health needs, you can actually come on board on Unite Us. We do have our programs available on Unite Us, in which we do have our Walk with These program. You can easily find our program in Unite Us. If you go on the education physical activity, you will be able to find our Walk with These programs and our partners who are offering the programs. It will walk you through some eligibility requirements that is appropriate for the person to join a Walk with These program. And so the age restriction is 18 years and over. That's the population that we serve. The program it is provided in English and also Spanish. We do have a Walk with These locator that's also on our website where you can find local parks and trails that is ADA accessible. And likewise with Tai Chi for arthritis, that is also in the Unite Us platform. If you search sports and recreation and wellness and physical activity, you'll be able to find the Tai Chi for arthritis partners in Virginia. Once again, eligibility is 18 years and over. And the same for our chronic disease staff management program. So as you can see, all three of our programs are part of the Unite Us platform. And in order to have access to this, you can email us. And if you'd like to be part of the Unite Us platform, you're a nonprofit organization, we would gladly get you connected. Okay. And so once you get into the platform, you're ready to find a program. So it give you the steps to walk through it. We also in partnership with Arthritis Foundation, which you can actually go on their website and it will actually show you some guidelines, steps on how you can get connected to the Walk with These program in Virginia as well. And then we have our Find Help partner with findhelp.org. Find Help is also on our webpage where you'll be able to, this is for anyone. So if you're not part of Unite Us platform and you're not interested, but just want to go to a website to find a program near you, you can go to findhelp.org and you can find all the Walk with These, Tai Chi, and chronic disease staff management program partners and connect with them directly. Now I'm going to take it over to Karen Day. She's going to speak more about our Virginia Arthritis and Fall Prevention Coalition.
Thank you, Mona. As Mona said, I'm Karen Day. I help manage the arthritis program. And several years ago, when we started the arthritis program, we started a coalition. What we found was that Department for Aging and Rehabilitative Services, and Pebbles is going to go over one of their programs in a minute, also had a coalition. So we joined together into the Virginia Arthritis and Falls Prevention Coalition. Currently, we have about 70 members from all over Virginia, public and private agencies. We meet twice a year for 2 hours virtually. We cover the months. For Arthritis Month is in May, so we do a 2-hour program in May about different subject matter about arthritis. In September, we do Falls Prevention because that's Falls Prevention Month, and again, a 2-hour virtual meeting. In between, we do periodic updates and send information to our members about things that we think they might be interested in or to share information. So if you're interested in becoming a member, there's a couple ways you can do it. You can go to our website at Virginia Department of Health Arthritis Program. There is a coalition page, but you can also just email me directly. It's karen.day@bdh.virginia spelled out.gov, or go through Pebbles. She knows how to get hold of me, as does Mary Beth. And just let me know that you're interested in becoming a member so that I can add you to the distribution list. And obviously our next meeting will be in May and be about arthritis. It was nice meeting everyone, and we really appreciate your interest in our programs today. Pebbles, I'll send it back to you. Thank you.
Awesome. Thank you guys for such wonderful information. Are you guys excited? Because this has been some great presentations, and we're so grateful for our partners who have come on to just really do this with us. We do appreciate you very much. So the next presentation, let me get that to share. So this is a brief overview of information about a matter of balance, which is part of the Virginia Department of Aging and Rehabilitative Services, known as DARS, is their fall prevention education. So let me give you a quick disclaimer. I am not employed by DARS, neither a trainer nor a facilitator for this evidence-based program in any way. This presentation was supplied by Andy Platia. She is the Prevention Programs Coordinator for DARS, and I am sharing this on her behalf as a resource. So please put any questions that you might have about this presentation in the chat, and we'll make sure to include them in the responses so that Andy can respond, and we'll have a Q&A document that will be available later on the DBHDS website. So a matter of balance and bingo size are evidence-based health promotion programs to reduce the risk of falls in older adults, as you've heard about bingo size earlier from Jody. DARS chose both of these for its fall prevention program, understanding that the importance of utilizing evidence-based programs offer proven ways to promote health and to prevent disease among older adults. So let's talk a little bit about the structure. A Matter of Balance is an 8-week structured group intervention that emphasizes practical strategies to reduce fear of falling and increase activity levels for older adults. Participants learn to view falls and fear of falling as controllable. They set realistic goals to increase activity levels, change their environment to reduce fall risk factors, and exercise to increase strength and balance. Participants meet once a week for 8 weeks, either in person or virtually, with each session lasting for 2 hours. Attendance is recorded, and those who attend 5 out of the 8 sessions are considered to have completed the program. In order not to exceed the group limit and to facilitate more social interactions and active participation, no new members are added after the second session. Excuse me. Okay. So for each week, the leader will present a topic. The topic will be used in that week's group discussions and activities. There is always a 10-minute refreshment break provided halfway through each in-person session. Starting with week 3 and continuing through week 4 through 8, the participants engage in exercise for the last 35 minutes of each session. And here we will just mention a few of the exercises that are taught during a Matter of Balance workshop. They include foot circles, ankle rolls, and then look left, look right. So for the foot circles, the ankle is one of the most important balance joints. The ankle joint responds to changes in terrain and reports to the brain and other muscles important necessary information for adjustment and safety. The ankle rolls may improve range of motion and balance. Toe stands, this exercise improves balance and leg strength. And then lastly, the look left, look right, neck range of motion. This exercise can be done anywhere at any time. It improves neck range of motion and it is helpful in maintaining your ability to look left and right in general. So this is an example of a power of positive thinking activity utilized in the program. For each previous question a participant answers agreed to, they're told to go back and write a positive sentence that shows they have control over their fear of falling. So for instance, if someone agreed to being generally nervous while walking, they would put a positive spin on that and say something like, I am confident when I walk because I have taken steps to prevent a fall. And such steps could include exercising and wearing sensible shoes. So again, this was just a very quick snapshot of a matter of balance. So for more in-depth information about the program or to find a class near you, contact Andy Platia at the information on the slide, and you will have this information on the DBHDS website. Okay, we're going to move along. Before we move forward, again, I just want to thank all of our guest presenters for the evidence-based fall prevention programs. Such a resource there, and I hope you guys have gotten a lot of information from that, and you are going to choose to maybe utilize some of those in the future. So now we want to share with you 2 more tools that can help you learn about and access fitness resources. The first one is the Fall Prevention Health and Movement Resource Booklet. Now, the Regional Quality Council for Region 4 developed a 15-page activity resource booklet featuring several different areas of health, exercise, and fitness opportunities in Region 4. These activities can help promote strength, balance, and fitness in support of preventing falls and trips, along with other health, wellness, and socialization benefits. So the information that you are viewing now is in presentation mode. This is so that we can get as much information on one page. So the numbers will look a little different when you download it to print it, as it will print in booklet format, and you'll be able to fold the pages and create the booklet. So under each section, there is a brief description of the program or programs offered and corresponding contact information for further inquiry. This list is definitely not exhaustive, but it will give you a good starting point to explore. And this is just another page. Another page. And this also, for those who are on the call from other regions, this information may give you some ideas of like places in your area that you can identify as well. Another page. Okay, and also there are some research engines, as you heard through the presentation, to help identify resources in your area, and many of the state agencies and their partners are able to support in identifying resources as well. Now, on our last page, these are the links that we have for the DBHDS fall prevention resources on our website, and you can check those out. One other thing that we have also updated the fall prevention resource flyer, which is great to keep handy along with your booklet. It includes links to DBHDS fall prevention trainings, root cause analysis training, and other educational resources related to this topic. So how would you use these? It would be good to print out to give copies to individuals, or you can even use these during the planning meetings for your individuals. So Here are some ideals for using the overall information from the webinar. Determine how can you help identify people identify their type of exercise interest. Maybe you can set up opportunities for people to try different activities. Of course, we always recommend consultation with your primary physician or qualified healthcare professional for the appropriate medical advice before engaging in any exercise or fitness program as needed. There are also opportunities, as you heard, for agencies to explore staff members becoming trained in one or more of the evidence-based programs and then offering those through your organization. All right, I think that's it. That we have questions and answers for right now. So Mary Beth and Jody, is Mona still on? Do we see any questions? We have maybe 5 minutes to get 1 or 2 questions in. Were there any questions in the chat?
So there were not questions in the chat yet about the programs, but a lot of people say this is very helpful information and they really want the slides and all the contact info. So I think
Awesome.
our presenters are going to be getting some emails and some calls, I think.
Excellent, excellent. Well, you can still send us any questions that you might have, and we'll still try to put together a Q&A document that we will place on the website. So if you think of anything afterwards, please feel free to contact me and we'll put that question and answer document together.
This is Mary Beth. I don't have a question, but I guess I want to give kudos really to Region for Quality Council and Pebbles specifically in the development of that booklet. This is my little promo for that booklet. I think it's fantastic. It's going to be a great resource for you all. All the programs that were presented today are in that booklet. You probably saw all the YMCAs are listed, all the parks and recs are listed. And Pebbles like called everybody she could contact to make sure, and Pebbles and other members, just to make sure the information was correct. Any additional like notes that people needed to be aware of. I just wanted to just emphasize how important I think that booklet is and will be useful to everybody.
Thank you, Mary Beth. It was definitely a labor of love, and we had a wonderful work group that they did an excellent job. And again, every place was contacted and spoken to and made sure that we had information that is correct. So I thank the work group. I thank you, Mary Beth, and all those who had any part in this. It was really a great labor of love. So thank you guys, and thank you for the compliment. So we have one last thing, and we don't want you to go yet. We have a webinar evaluation that we would really love for you to take a moment to fill out. And I believe that link is in the chat.
Yes, I just put it in the chat for people.
Awesome. Awesome. So don't leave without doing that. There is a question on the webinar evaluation asking if you plan to use any of the resources that were presented today. We would love the opportunity to contact you about your experience, some months down the road, just so we know how it worked out. So we're really excited about that for you guys. So please take a moment to fill it out. And finally, again, if we do get questions, we will have the Q&A document available, and we'll announce when that Q&A document is available on the DBHDS website. So again, thank you guys so much for being here. Thank you for registering. We had a good number of people to register, and so we're hoping this information was very informative as we're hearing, and that you will use it in the future. So fill out your forms, your evaluation forms, and thank you for being here.
I'm going to put the link in the chat again. I'm a little worried that it'll disappear when you close the webinar. So if you haven't done it yet, go ahead and click on the link so you have access to it.
Yes.
And we'll probably also send it in the email, in an email afterwards.
Yes, we can do that as well.
Yeah. And it might take, so we are recording this. It might take a bit, like a week or two, to get the recording posted. And so, Pebbles, we can let people, we can send out an email with the slides and with the recording link when that's available.
Sounds good.
And folks are even adding their colleagues because they want them to have the information as well. So that's great. We'll make
Awesome.
sure to get that.